The All Women Count program is a government-funded program for the early detection and screening of most common women cancers.
They can have their cervical screening, so it includes the Pap test, it includes their pelvic exam, they can have their breast evaluations, they can have clinical breast exam, they can have mammography, ultrasound if they need it.
I've been with the All Women Count program for about 3 years. When I was pregnant with my daughter, I had a Pap smear. My doctor told me that my Pap smear was abnormal. And after the baby, she did a procedure and everything. But I had to continue doing the checkup every year, but I didn't have insurance. So I went to a clinic here and I was asking them how much it would cost me to get a Pap smear every year, and they told me about All Women Count. That's how I found out.
I think a lot of women who are maybe working 1 job, 2 jobs that don't offer benefits, you know, sometimes that mammography, you know it's important, you want to have it, you want to do it for yourself and your family, but you can't afford it. And a lot of women, if the family needs something or the kids need something, it's very common that they will put their own needs aside and do things. They're kind of self-sacrificing and do things for the family.
When you have to pay the full price for a clinic visit or the full price for a Pap smear or even a mammogram, I think that's something that you would probably put off. And in general, for example, breast cancer, people have breast cancer with no symptoms for a long time because breast cancer is usually not painful. And unless you're really good at doing your selfly breast exams every month, you're not going to pick up on that yourself. And so if you're not having any symptoms, in general, you're not going to go in and have your screening if you have to pay for it out of your own pocket.
You know, a lot of people stay at home, they don't go to the clinic. And by the time they go there, they have many problems. Right now, I'm going to school, I'm going to college. I don't have insurance. I go to school full-time. I don't have insurance, but at least I know that once a year I can go there. They will check my whole body, not just a Pap smear, but I get a physical every year.
I think the patients receive the greatest benefit on early detection and screening for something that they might not go into the clinic for. Women are thankful for the program because they know that screening and early detection is very important, and they know how expensive healthcare is if they have to pay for it out of their own pocket.
It's been a tremendous asset to my practice to be able to encourage women to have screening and know that they can participate, that they're not excluded just because of income.
The most frequent question I hear about the All Women Count program is how much does it cost? How much will it cost me as a patient? And it's always a pleasure to me to explain to them that it won't cost them anything. That they would be able to get their screenings for their mammogram and their Pap smears and their blood pressure and their routine clinic visit without any expense out of their own pocket.
I suppose another question that's asked really are, what are the guidelines? You know, how do you get enrolled? What are the guidelines? What's the eligibility? Fortunately, most of the clinics here, there's a number of providers throughout the state, and they're very good at sitting down and working and can sit down and explain the program, go through the guidelines, make sure that they do meet the criteria, and really help the person make sure that the paperwork gets all filled out and sent in correctly.
I think the first thing was the age and the money, how much money you make, and I qualified with that.
It takes as long for the patient to fill out their form of the paperwork and for you to verify that the income that they have written down is within the guidelines that meets All Women Counts criteria.
And after that, everything was okay. I could go to the clinic.
The clinic staff then completes the necessary paperwork to transfer it with the lab testing to the peer office of the All Women Count. Once it has gone to the peer location, in general, the clinic actually has nothing further to do with it, and any questions, it's easy to contact any of the people through the peer office. They're always available by phone.
And if there's ever questions or different things, whenever they call peer and talk to the All Women Count staff, they just really they had good experiences and felt that it was great.
My biggest advice through the All Women Count program is don't hesitate to enroll a patient who does not have insurance in All Women Count. it would only be a benefit. It would never, ever be anything detrimental to the patient or to the clinic. People, when they first look at the all-women count paperwork, they think it's cumbersome, but honestly, it's very easy, it's habit forming, it's systematic. There should never be any hesitation because it's just going to always be better for the patient to enroll them into the program than have to deal with the consequences of what if I have an abnormal test.
If the age and the income is okay, then you should call the All Women Count program. They will help you because they help me.
There are numerous stories of people who are really helped from the All Women Count program.
I still think we have a mission to get more of the word out that All Women Count is there and that it's so effective and good. Because there are certainly women that we haven't quite reached yet and they don't know about it.
A lot of people don't know about it, and even when the doctors tell them about the All Women Count, people are very skeptical about it. I think that people think that, okay, it's a program, maybe they will just help a little bit. They will pay maybe half of the bill, not the whole thing. After the first result of an abnormal pap smear, I wanted to know everything was okay. So me being able to go back every year to know that I'm okay, it's nice. It's a blessing for me.
If they need a biopsy many times right during that first visit, we can go ahead and probably just put in some local, image the spot, make a little incision, probably no bigger than about the end of your little finger, and place a needle in, get a little sample. It's just put a little Band-Aid on and they're back in the car in 30 minutes. And so they can come in and not be dragged out over weeks and not have to, always reapply for everything, right, every little step. We can take them in and really do the full evaluation.
There are other procedures that will follow up for All Women Count on abnormal pap smears. If, for example, the female has an abnormal pap and would need a colposcopy or a LEAP procedure, that's all covered by All Women Count too. And it just takes another encounter. It would all be under a separate encounter, but it all goes through All Women Count.
You hear the diagnosis of cancer, and I think a lot of people, it's a very scary word. You think, oh my gosh, I'm going to die. What's going to happen to my kids? What's going to happen here? And to help that person go through their cancer journey and try to maybe empower them to make decisions and empower them to go through and make good choices and hopefully go through their surgery and their treatment. That's really fulfilling for me.
I was terrified because I knew I could have cancer, cervical cancer, and that was very hard. And she told me that it was very important for me to keep doing the checkup every year to see if any changes come back.
A lot of women are working a lot of hours, and I think there's a number of jobs that have maybe cutback hours or don't provide full benefits that cover screening. And so I think a lot of women are, without this type of a program, are forced to make some really tough choices. Do I take care of myself and get this test, which is rather expensive, or do we put this money towards needs of the kids, other health needs, food, entertainment? What do we do? And so this is something that's just a real basic screening that people can have and not have to make those difficult choices every year. What's really nice sometimes then is a year, 5 years, 15 years later to see that person come back and they're doing well. Some people have maybe a bad stereotype of maybe people that need a little help, and a lot of the women that I talk to, they are working really hard. They're working 1 and 2 and 3 jobs, and they've got kids, and they are working really hard. And yet, healthcare sometimes for them is too expensive. And I think that there are jobs that don't offer services. And so I don't think this is really welfare. I mean, I think that there are certain things that just as a society and a good place to live, that it shouldn't matter whether you have money or not, that you get certain screening services. I just think that that's something that it's a good thing to offer to everyone. You know, my mom had breast cancer, my husband's mom died of breast cancer, and I'm the mom of 4 girls. You know, I'd like to see this not be a problem in the future. I'd like my girls to grow up and not worry about this, and not think, wow, both my grandmas had this.